and transitions, okay? Everything in life can come back down to cycles, balance. Think about it, the weather. Summer, spring, okay? And then you have the menstrual cycle, puberty, adulthood, menopause. What do you have there? Cycles. You have transitions between puberty and adulthood, between adulthood and menopause, okay? And we're not leaving the gentlemen out because we've got andropause, okay? And I'm gonna come back to that. But cycles, balance, and transitions. Everything also is dependent on balance. Too much of something or too little of something is just as bad. Whether it's too much of X or too little of Y, you need balance, okay? 80% of women in the United States complain of PMS. 50% of women have fibroids. 80 to 90% have perimenopausal symptoms. Premenopausal breast cancer has increased by 30% in the last 30 years. 90% of women have menopausal symptoms. Osteoporosis affects about 50% of women over 50. Who said wow? Yes, 50% of women over 50, if not addressed, will at some point in time get osteoporosis. Hysterectomy and breast surgery are the most common surgeries done in most hospitals. How's that? Still, even to this day. And heart disease and breast cancer kills more women than anything else. Now, the menstrual cycle. This is a depiction of the uterus with the ovaries and the tubes. This is the hormonal graph. This is progesterone. The blue is progesterone, the pink is estrogen, all right? The first half of the cycle, let's use 28 days. The first half of the cycle, estrogen is dominant. The second half of the cycle, progesterone is dominant. And that's going to be important later on, okay? Now, what does the progesterone do? The progesterone causes the follicle to mature, and that's called ovulation. Now, this is what happens in the uterus. So this is actually a depiction of exactly the same thing, but telling you in different places what's going on. This is what happens in the uterus, okay? When the progesterone comes out, it builds up, peaks, and if there is no pregnancy, it sheds. That's the same graph. As I said, progesterone is dominant in the second half of the cycle, estrogen in the first. All right? Now, what is estrogen? Estrogen is a hormone that is produced by both men and women, by the way, but of course, mainly by women. And what does it do? It gives females our sex characteristics. It builds the tissue in the uterus. And it prepares the body for pregnancy. It gives us our characteristics, as I said before. There are three main estrogens: estrone, estradiol, and estriol. The estrone, which is called E1, there's very little of it, and it's not very potent. Estradiol, which is called E2, and that's because of the structure, which I'll show you later, is made by the ovary, and that's the working estrogen. Estriol has the most potency, but it's also the most dangerous one, okay? Now, xenoestrogens, we're exposed to all day, every day. Plastic, I mean, the chair you're sitting on, etc., okay? Anything man-made with estrogenic properties is called a xenoestrogen. And then you have phytoestrogens, which are plant estrogens next. Now, estrogens regrow the menstrual tissue, makes the follicle go to an egg, supports the vaginal tissue, stores fat. Anybody notice that as they got older, they stores fat, and it decreases thyroid hormone. That's another very important characteristic. Next. What is progesterone? Progesterone is the second uniquely female hormone. And progesterone is actually made by the corpus luteum, which is when the egg matures and comes out, ovulation occurs, progesterone is made. Now, it says there, progesterone can be made from wild yam and soybeans. We'll come back to that. Provera and Depo-Provera are not progesterone. Okay? And we'll also come back to that next. What are the functions of progesterone? The main functions of progesterone is it supports gestation. And the last one, it says protects against cancer. It balances the estrogen. So progesterone is the balancing hormone. It's also a natural antidepressant and a natural diuretic. Okay? It also helps in restoring sex drive. Now, what is Premarin? Pregnant mare's urine. They didn't even try to hide it. Okay? Premarin. Pregnant mare's urine. Now, little bit of background. In the 1930s, this goes back to the 1930s. In the 1930s, they, what was his name? This guy, in 1938 to 39, got the Nobel Prize for coming up with, isolating the hormones, okay? And he did a good job, all right? However, they started using this in 1942. They started giving women Premarin, this pregnant mare's urine stuff. And for the next about 20 years, it was the gold standard. However, halfway into this, they recognized the fact that something was going on because the key didn't fit the lock, all right? When they recognized this was in the late 60s, they said, oh my goodness, we have got to stop giving women this stuff. But Wyatt Ayers was not about to lose all that money. So what Wyatt Ayers did was they said, no, we can't stop giving them this stuff. We have got to find something to counteract it. So what did they do? They took the balancing hormone and, next slide, they took the balancing hormone, which is the progesterone, and they made a synthetic progesterone to match the synthetic estrogen. So guess what? It's close enough that it helped, but guess what? It set up all these other things which were not good, okay? It actually created, and this one's very important, because it actually created a progesterone deficiency. Okay, let me explain that. You have receptors. The body has receptors for every hormone. Thyroid hormone has its receptors, male hormone, female hormones. The body has receptors. Now, my finger, my hand, this is what the receptor looks like. Okay? The equine, it's called conjugated equine estrogen, was close enough, but it didn't fit. Now, if you had a lock and you put that key in, would it open it? No. But what happened with the, and the same with the progesterone and same with all the hormones, what happened is it now took up all the receptors. Got it? So it really actually then created the progesterone deficiency, which is very, very important, okay? Progestins and Provera are not progesterone, okay? Next. Okay. Excess estrogen causes several things: breast tenderness, depression, fatigue, poor concentration, endometriosis, fibrocystic breast, water retention, fat gain. Next slide. Progesterone deficiency causes breast tenderness, depression, fatigue, poor concentration, fibroids, water retention. Do you see a pattern? Go back.
Yeah.
Okay, remember what I said? Excess, deficiency. What's important is balance. Next. Okay, now we as gynecologists practice gynecology made simple. Oh, take it out. Oh, they already saw it. What do you think is the first question? What's the first question your gynecologist asks you?
How old are you?
How old are you? That is correct. Okay? And if you're less than 45, you walk in, it doesn't matter what you're complaining of, they give you birth control pills. And if you're older than 45, you walk in, it doesn't matter what you're complaining of, they give you hormone replacement. And if you're either less than or more than 45, you walk in, what do? What do they give you next? Antidepressants. And guess what? If that doesn't work, what do? Cut it out. Gynecology made simple. Okay? No response to therapy, they cut it out. Next. Okay. We, as women, are born with a certain number of eggs. All right? And every month, as a woman ovulates, she loses not just the one that matures, but several others as well. Because at age, when you're born, okay, you got a significant number. At 20, you really have about 400,000. But look at this. It goes all the way down, and it goes down really fast. Okay? By the time you get to about 40, it's down to about 30,000. And if you think about it, that's why in terms of getting pregnant, you know, women have to, the optimum time is by age 30. Okay? Now, next. What is menopause? Menopause is permanent cessation of menstruation. The eggs are gone. Even those that are still there are not functioning. And the woman stops having a period. She stops being able to conceive and carry a child, okay? The ovarian hormones decrease. Now, the average age of menopause in this country is 50 years old. That's average. Anything after 40, we don't consider abnormal, okay? And I have women 55 and even as old as 60, so average. The two sets of hormones, the horse's urine and bioidentical hormones, are totally different. In that, bioidentical fits the receptors exactly. There is a substance called diasgenin, which is what is extracted from the wild yam and the soy, and which is compounded in the pharmacy, all right? And it literally fits it exactly. And that's why, that's the difference between bioidentical and synthetic. Now, this is Premarin, okay? conjugated equine estrogen. Now look at the structure. Pretend you're back in high school. Look at the structure. It's a 4-ring structure, but you notice it's totally different, okay? A double bonded O there and a hydroxy group there. Hydrogen here, nothing there. Okay, is this the same as this?
No.
Okay, look at progesterone and medroxyprogesterone, which is Provera. Look at the structure. Is this the same as this? Now what about the male hormone? This is what the body makes. This is what they cooked up at Wyeth Ayers or wherever. Okay, is that the same? No. So the key doesn't fit the lock. Why is the chemical structure important? Because the chemical structure dictates how the hormone is metabolized and what the byproduct is, okay? So even if you change one thing, all right, now I mean, this is pretty close, but even if you change one thing, it literally changes the way it functions, all right? Now, everybody knows her, I'm sure, all right? And she has actually become a champion and the face of bioidenticals. She has, and that was the first book, she has a couple of others out. Your Sexy Years and Breakthrough.
Bombshell.
Oh, I'm sorry?
Bombshell, I think. Bombshell?
No, Breakthrough. Okay, she is not a medical professional, all right? And so you asked me last week about the Wiley protocol.
Yeah.
I do not, and let me explain. We're talking about balance. The Wiley protocol, which is what she champions, says that you need to do this. You get 10 times as much hormone as you need. As far as I'm concerned, if I'm looking for balance and I'm trying to get you back to where you used to be, I don't need to bring you up to here.
Yeah, I think there's extremes. I mean, I do the water.
Yes.
Yeah.
Okay, that's why I said I do not use the Wiley protocol. It's just too much hormone. Next. Okay, but I'm happy that she has brought this to the forefront. I really am, because it's very, very, very important. Now, what is bioidentical hormones? Bioidentical hormones are made from soy and wild yam, as I said. The diastenin is extracted. It's exactly the same molecule, okay? It is biologically identical in chemical structure, and it fits the receptor like a key to a lock. So the body does not distinguish between bioidenticals and the hormones our body produces, okay? Now, you listening to them talk, and by them I mean the establishment, you would think that there is no research out there and there's no science to back this up. Guess what? There is as much science to back up bioidenticals as there is to back up the synthetic stuff. Because the synthetic stuff, they all started right around the same time, okay? This was discovered in the 1930s as well, okay? And there are lots of studies and lots of stuff to back it up. Why doesn't everybody know about it? Why doesn't everybody use it?
Medical, pharmaceutical, industrial complex.
Right.
Big pharma.
I have a question.
Yes.
I thought if it's bioidentical, then it has to be no side effects, but here it has fewer side effects. So what does it mean?
Well,
And synthetics, yeah.
So it's still side effect.
okay. Let me ask you a question. The side effects that we talk about, okay, with bioidenticals are usually because you're not balanced. Okay? Usually because you're not balanced. Now, and hold your question because that's going to come up again. Next. Oh, go back. Let me see. Next. Okay. Next. I like this slide. Okay, progesterone, estrogen, and testosterone are hormones, as you know, have a lot of functions in the body, okay? And when they're lacking, they cause previous symptoms and subsequent disease. Next. What are the symptoms that you can get? Does any of that look familiar? Anybody have anything up there?
Everybody has something up there.
Everybody has a lot.
Okay. Next. Now, Women's Health Initiative study. A lot of people are also familiar with this because what happened is in the 70s when they finally said, you know, enough is enough. You all have to just cut this, stop prescribing. You doctors need to stop prescribing that stuff. The drug companies donated the pills and said, let's do a proactive study. Let's do a 10-year study. They had 17,000 women between the ages of 55 and 70. And they did this proactive study. However, they started registering people in 93, and the study started in 98. By 2002, actually as early as 2001, there were significant questions. But again, the drug companies squashed it. However, by 2002, they couldn't squash it anymore. Okay? And if you look at those numbers, there was a 41% increase in strokes, 29% increase in heart attacks, 26% increase in breast cancer, 22% in total cardiovascular disease. There was a decrease in colorectal cancer and a decrease in hip fractures because it does, to a certain extent, help your bones, okay? But look at the next two. There was a 60% increase in blood clots and a 200% increase in dementia. 200%.
This initiative study was done with women that were taking nothing or were taking horse urine?
They took healthy women,
Right.
and between the ages, as I said, of 55 and 70, and these were all healthy women, non-hysterectomized also.
Right.
Healthy, non-hysterectomized women. And they gave them the equivalent of Prempro.
Okay.
They gave them 0.625 of Premarin
Yeah.
and 0.25 of medroxyprogesterone acetate. Okay? So, now, I said before that there was a decrease in the hip fracture and colon cancer rate. However, that was just in the Premarin-only group. There were three groups.
Yeah.
There was a Premarin-only group, there was a Premarin and progestin group, and there was a placebo group. Okay? Now, also of significance, a lot of women dropped out of the study.
So it would have been worse.
It would have been worse. Almost 40% actually dropped out. So if you can imagine, this was less than 5 years, and 40% dropped out, and those numbers are so bad. Can you imagine what would have happened, number one, if everybody had stayed in, and number two, if they had not stopped it? Next. Okay, and I talked about this already also. Next. Now, the importance of this slide is the fact that all the hormones are related, basically. All right? Balance again, it comes back to that. Everything depends on something else. All right? And I know it's very crowded and you can't really see it, but if you look at the different pathways, even the male hormone, okay? Everything starts from cholesterol, by the way. All the hormones, male, female, thyroid, everything starts from cholesterol. okay? And where it goes and what it does and what it becomes is determined by which gland produces it, etc. Next. So, natural, bioequivalent, or bioidentical hormones are safe and are definitely effective. They can be given as patches, creams, gels, sprays, and pellets. Oral administration, you get highs and lows, peaks and troughs. It goes through the liver, so there's a problem with increasing the clotting factors, all right? And the conjugated equine estrogen, or Premarin, okay, has a higher conversion to the bad testosterone and the bad estrogen next. Okay? Transdermal is actually much better. Doesn't go through the liver, because the skin, it goes straight into the bloodstream, all right? However, it also has its drawbacks, because what happens is you contaminate people, okay? You have it on you, like men, especially with the testosterone, okay? It can actually affect the spouses and the kids or whatever, because they go and they play, you know, with the dad or whoever, and it rubs off on them, and that's obviously not a good thing, okay? So the other thing is, because of the receptor problem in the skin, you have to change where you put it on a regular basis, okay? Or the receptors get saturated, all right? So after a while, it stops working. So it works pretty well initially, but then after a while, it stops working. Now,
What was the after what? I missed the last after what? How long did it say?
I'm sorry?
The last range of that?
I'm
Was it
sorry.
1 to 3 years? Does that mean you can go to 1 to 3 years in one place, or
Oh, no. No,
how
it's,
often do you have to vary it? Every week,
I tell
every month?
everybody every day.
Really?
Yeah, put it in a different place every day. So you use a different place every
So
day.
what does that mean about 1 to 3 years? That means it doesn't work at all
It
after 1 to
takes,
3 years?
yes, yeah, within a year,
Wherever you
within one,
put it, that's
it
it.
doesn't matter where you put it, it just, the receptors are saturated, so it doesn't take it up anymore.
What do you
Yes.
do then?
So you have to change every day.
You definitely have to change where you put it, because the receptors get saturated.
What is the best place to put? It's like
Any fatty area, but it
Ah,
doesn't
It
matter.
doesn't matter because you're.
Doesn't matter where you put it,
Really?
Doesn't
but
matter.
any fatty tissue.
Oh,
Mhm.
doesn't matter.
Doesn't
No.
matter, because you're
Even
gonna
on
go
your
beyond it
stomach, you
somewhere.
could-
Oh, sure, that's
Oh,
right.
yeah, stomach's a good
Very
place.
good, that's very good.
Mhm. Stomach's a good place. Now, patches. There are estradiol patches out there. There's actually a bioidentical patch, estrogel, okay? But again, you have a problem with changing it. And it's good in that it, again, goes straight into the bloodstream. But again, you get the peaks and troughs, because you put it on and it's the patch that's twice a week. You get a high level, and then it comes down, and you're back where you started, and you put on the next patch, and you're up again. Next, okay. Injections, and most men take testosterone. A lot of men take testosterone by injections, okay. And again, the same thing, peaks and troughs. You know, when you get the injection, you go way up and comes down, and you're back where you started. Next, okay. Over-the-counter remedies really don't work. I mean, they relieve the symptoms only minimally most of the time, and they do nothing to fix the problem. Nothing. All right? So, we did that already in terms of absorption. We have, go back, right. Pellet therapy is actually what I recommend. And the reason I recommend it is because of the absorption problem, all right? Again, it goes back to the 1930s. But what happens is, I make a tiny incision, pop it under the skin, and it doesn't go through the liver. There's no peak and trough because the vessels bathe it and take what it needs when it needs it, okay? And the only downside is breakthrough bleeding in non-hysterectomized women, okay? And if you're balanced, if the progesterone level is physiologic, you don't get that, all right? So, next. It really is the best mode of administration. Now here we have, and you see what I'm talking about with peaks and troughs, you get a roller coaster, you know, you're in Coney Island, okay? You get a roller coaster effect. The patch does the same thing. It's a longer period, it's 3 days, but it does the same thing, okay? The implant basically is a nice sine curve. It's perfectly steady. You get the level that you want, and it basically stays there until it's used up. Next. Okay. The other good thing about the implant is that it's customized based on your metabolism, your weight, your hormone levels, etc. We figure out how much to give you. And just as no two people have the same genetic makeup or the same symptoms or the same metabolism, okay? It's totally customized for you and therefore works that much better. Now, testosterone in women, and a lot of women don't know that they actually have and need testosterone, but it is responsible for your libido also, for your mental clarity, okay, and muscle, the way you use muscle when you exercise, as well as, you know, the deficiency leads to depression, fatigue, same brain fog men get it more than we do, but the same brain fog. Next, okay. And testosterone deficiency in men, again, libido and erectile dysfunction, brain fog, again, and the last one is very important, increased belly fat, okay. Next. Andropause. What is andropause? Everything I've talked about in women, andropause is the same thing in men, okay? It is a natural decrease in male hormones. Now, a lot of people don't know this also. It starts as early as the 20s, the late 20s. I had a man in here a couple of weeks ago, a 29-year-old with a testosterone level of 290. Normal is 900 to 1500. 29 years old. Now his was because of abuses, and I won't go into it, but again, 29 years old, 290. And what was he complaining of? Erectile dysfunction, decreased libido, brain fog. I mean, this was a Wall Street person, you know. The other thing is, it's gradual, it's more gradual, so it's not as dramatic. Women basically do okay until they get to the 40s, okay, and then they go, all right? With the men, it starts, and it really inches and inches and inches down, okay? So because the change is more gradual, most men don't get it until...
I think it's old age.
Yeah. But you see, now there you go.
Except for the 29-year-old, right?
No. You say they think it's old age. People think that your hormones decline because you got old.
It's reverse.
It's the reverse.
I'm saying that's what we're...
You get old
I think,
because your hormone declines.
Yeah.
Okay? And that's very important.
All right, good.
Okay? Now, how many of us know men who go out and, you know, get to 45 or 50 and go out and buy the Ferrari and get the 20-year-old girlfriend and, you know, hey. Next. Now, the benefits of testosterone in both men and women, okay? The list is self-explanatory. This one is the one that I think is actually probably most important, okay? Agreed?
Okay.
Next. So, how do we get bioidentical hormones? The compounding pharmacies. Now, I know you've all heard in the past 3 to 6 months of, not accidents, but of, messes with compounding pharmacies. Remember the kid that died and that type of thing. They are, however, real pharmacies. They are very well regulated. They're very well supervised, all right? And they use the same standards as the drug companies use. It's all USP material, and the inspections and everything are exactly the same, all right? So, and here we go, the same standards, standardized materials, okay? Training, state board, FDA, DEA, the whole bit. Next. Okay? Next. And as I said, they use exactly the same operating modality. Next. So, remember that 60 is the new 40. How's that? Okay? I had an 89-year-old lady in here today. 89. And I mean, she was absolutely amazing. All her marbles, sprightly, okay, etc. I have women in their 80s. Now, I'll tell you, I've been doing this, and I found this for me. I had such a bad transition, okay? I would literally break out in the sweat and have to rip off the jacket and rip off the blouse. I mean, I remember I was on the Quality Assurance Committee at New York Hospital for 10 years, and I'd sit there and go, oh, I mean, here it comes. I mean, forget it, and you can't really take off your blouse. I mean, I can take off the jacket, I can't take off the blouse, okay? And I went out and I looked for it. I started with the creams. I actually started with wild yam. Let's go back that far. John Lee, okay? Started with wild yam. And it worked for a while, maybe 3-4 months, okay? And then I started with the creams. Within a year to a year and a half, wasn't working anymore, okay? And there is no way on the good Lord's earth I was gonna take the horse's urine junk. I couldn't do that. There's too much cancer in my family, etc., etc. And I found the pellets for me. I did my research, I found the pellets. I'm telling you, it is amazing. And I tell you something, if it didn't take care of the flashes and the sweats and the other symptoms, the vasomotor symptoms and all that stuff, the vaginal dryness and all the stuff that it does take care of, you have this sense of well-being that nothing bothers me. I mean, nothing bothers me, okay? I tell you, about 2 years ago, I hadn't gotten my pellets. It was to the point where my PA in the office I'd start getting irritable and bitchy, and she'd look at me and go, Dr. H, when's the last time you had your pellets? And I'd say, you're right. I need to check, I need to get them, all right? This particular time, I don't know what was going on, and I was 3 months late in getting my pellets. There are people who will never speak to me again. I mean, literally, there are people who will never speak to me again. I got my pellets, I slept all night that night, and the next morning I woke up and I said, now why didn't you do that? And said at that point in time, I will never, ever, 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 ever allow this to happen again.
So for how long these pellets are working?
Everybody's different. I have some Wall Street lawyers who call me like every 3 months, literally. And it's like, Dr. Harris, I was okay yesterday, but I gotta see you, okay? And sure enough, it's almost as if they crash and burn. Okay, but they're in high-stress jobs and that type of thing. In general, it lasts about 6 months, in general. The first time, about 4, but once you top it off that time, it can even go 7 or 8 months. And then the way we follow it, again, we do the testing and we get a graph because people's bodies and metabolisms and stuff are different. I have people who, as I said, come in every 3-4 months. And I have people who 6, 7, 8 months, and they're fine.
How do you inject it?
It's not an injection, it's actually a surgical, a mini surgical procedure. Trust me.
Every time you have to cut?
Yeah, but you know what? The incision is not as big as the tip of my pinky. It literally is not that big. It's this number 11 blade and it's one puncture. You put the trocar in, you load the pellets in the trocar, pop it in. I did 3 yesterday, okay? What did everybody say when I was finished? You're finished? I didn't feel anything. It really is not.
You don't
I'm a
have
good
to sew
technician.
nothing, just-
Nothing, no sew, no nothing.
If you don't have to
Steady
take it
stop.
out later on.
Nope.
Oh, it's just dissolves. that's
Yes, the body uses it.
all.
Yes.
So let me ask you. You know, I had done bioidentical hormones for years and my levels weren't balancing. So, but when I switched to a modified Wiley, they balanced. They
Okay.
hit me, okay? I still have issues. So what I'm wondering is, I like the philosophy of the Wiley, that it follows the rise and fall of the estrogen and progesterone. Now, is your body that smart that it knows?
Your
that
body
it-
is that
That
smart.
it knows to take as much?
It's as
and
if you
then
got your
increase it?
ovaries back.
Honest to God, okay.
It's as if you got your ovaries back, as if you
Okay.
got your testes back.
Can the pellet be felt?
No, it's a rice grain.
You want me to log it on your
Okay.
So how
It's
long
the
does it
size of a rice grain.
Like if you had a massage, would that mess it up
No,
or pop it up or I don't know?
So let me ask you, what happens if you're like, do you actually you can go from one day to the next and go, holy Christ, I mean, like something's just
not
happened.
usually.
Not
No.
usually.
It
So-
is gradual.
It's a, so
It
then,
is.
yeah, so you,
It is gradual.
so what if you're out of town, out of the country, and it's a help? What do you do?
I'm sorry, say that.
What if, like, you know, you're not here, I'm not in the vicinity of you, and something has happened like that?
Oh, it's not the type of thing where it's an emergency, we have to go to an emergency room or something like
No,
that.
but I'm just saying,
It's,
yeah,
you know, you would come in, get your testing, see, which is the other thing, as I said, it's customized. You know, so we know, I mean, people will call and say, I think I'm starting to run low, can I come get tested? Even though they're not supposed to be tested for another month.
okay.
Or somebody will not come and will call and say, hey, you know, you really need to come in. Says, no, but I'm doing okay. I'll come get tested anyway. And you can tell, trust me, you will know.
Right. Well, it's interesting, you wonder what normal is anymore, you know what I mean?
There you go.
You know what I mean, so
Yes.
yeah,
Two
yeah.
questions.
Yes.
How long does it take to feel that it's works?
We tell people 3 to 5 days, but usually my phone rings the next day. Usually my phone will ring the next day. Thank you, thank you, thank you. I slept for the first time in 3 years last night. Okay.
Okay. And
Usually my
next
phone rings the
question.
next day.
Before you insert and plant it, you have to do the blood test probably, yes?
Oh, yeah.
And you're
absolutely.
doing here, or you send it to special laboratories?
No, it's sent out.
Uh-huh.
So you have to wait to get back.
Why I'm asking that, because I have insurance, I know that you not accept, but if it's special laboratories, they pay for that, so.
I'm sorry? Yeah, the insurance should pay for the lab testing, yes.
That's what I mean.
Yeah, they won't pay for the procedure, but they'll pay for the lab testing.
So that's a pellet,
That's a pellet.
so that's like a
Now,
testosterone or something?
this is actually, the testosterones are a little bigger. This is an estradiol.
Okay,
And the male ones
It's a
are
lot
even
smaller
bigger.
than rice grain.
Yes, the testosterones are rice grains. This is the estradiol, which is
Tiny.
tiny.
So
Okay,
you
but
think-
then this is what, 6 milligrams? This is 10 milligrams.
How many
Okay, so
milligrams is the testosterone?
more. The testosterone starts, well, it depends. Most women need somewhere between 6 and 25 milligrams of estradiol, okay? And between 75 and 150 milligrams of testosterone, most women. And then most men, however, need 1,600 of testosterone. The fused pellets, the male pellets, are bigger. They're about the size of my pinky fingernail, half.
Real thin, real thin.
And most men need between 6 and 12, again, depending.
6 and 12 more.
Pellets, 6
Each time?
each time,
Wow.
yes. At
It's like
16.
not health efficient.
Wow. Every 4 to 6 months.
6 months.
How, has there been any studies, I mean, how long have the pellets been going in? Has there been any studies as to their, and any type of long-term
Yeah.
side effects as well as efficacy?
Since the 1930s,
Yeah.
okay?
I mean, it hasn't,
Yeah.
it hasn't been popular, I mean, it was.
Oh, good, here's a testosterone, you can pass it around.
It hasn't been all that, hasn't really
It's
been
like
that
I've never
popular.
heard of
It
it.
was discovered then.
But I just told you why it hasn't been
No,
popular.
I understand, I'm just saying,
They
has there been
can't,
enough
they can't make
tests?
a lot of money on it.
No, has there been?
They can't make,
Has there been
Anyone.
enough tests, has there been enough tests? to check
there
the
has
side
been.
effects?
Oh.
There are even studies, there's
That's-
one guy, there's a guy in
That's-
Arizona
That's
who has a study with more than 1,000 women,
That's about
I
20
mean,
times
it'll
the
lay
size.
okay, who have breast cancer, who've actually had breast cancer, and there's no problem, none.
Yeah, I was just say, several friends are just frantic about
As-
doing biological hormones.
As a
business
matter of
industry.
fact, we tell people, you wait. Now, if it was estrogen dependent, sometimes we tell people, it's a lifestyle decision, okay? But there have been less, it almost appears to be protective. Because if normally 8 out of 100 women would get endometrial cancer, all right? The studies have shown with the pellets, literally, it's 0.8. So it's like 10% of the normal. And some of that has to do with because of the way you're followed.
The way you're, the what?
Followed, okay?
The way you're followed.
By the doctor.
Oh,
Yes.
okay.
Monitored.
Monitored,
Monitored.
okay.
Mhm.
So what's the difference with the estradiol creams and the pellets? Do a person that's got to worry about cancer, are they concerned about the creams as well? Do you know what I mean, or?
If it's bioidentical, it's bioidentical.
I know, so that's why I don't understand why they don't explore these other options.
If it's bioidentical, it's
Money
bioidentical.
has nothing
The
to do with it.
only reason is money.
It's
That's
exactly what the whole
You
system
cannot
is.
patent something that is found in nature.
Yeah, that's the whole
That
thing.
cannot be patented, and that is the whole crux of the matter. You can't patent something. They're not gonna spend, the drug companies, unless they had to change it so that they could patent it.
It had to
And
be stored.
changing it doesn't, the key doesn't take a lot.
The more you change it, the
Why
worse it
would
is.
the doctors tell them, you